When you're smiling, the whole world smiles with you. When you're laughing, the sun comes shining through. Keep on smiling, 'cause when you're smiling, the whole world smiles with you. Ba, 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 da, ba.
When you're smiling.
First impressions are priceless.
I'm Dr. Kenny Levine. For the past 37 years, we've been helping patients of all ages restore their smiles. Today, with modern technology and lasers, we're able to treat infants of 7 days old. We treat their parents. We help them not only keep their teeth, but restore function for the rest of their lives.
Call 954-603-7109.
Hi, this is Dr. Kenny Levine. I'd like to welcome you to a brand new show in South Florida. It's called Health Talk with Dr. Kenneth Levine. That's me. I'm a periodontist. I'm a dentist who's a specialist in treating the gum and bone of your teeth and doing cosmetic procedures in your mouth. But this is not going to be a show about dentistry. This is going to be a dental and medical show, talking about your entire body, talking about all the things that dentistry and medicine and all the ancillary services can do for you to keep you healthy and vibrant, young and attractive for the rest of your lives. We're going to be meeting with different doctors twice a week. The show is going to air from 6:30 to 7 o'clock on Tuesdays and Thursdays, and you'll be able to see it streaming live on the web at www.tvchannel19.com, and it can be seen anywhere around the world. So our guests can tell their friends all over the country and all over the world to look at us live, and they'll be able to come in and see what we're doing, what the latest advances are in dentistry and medicine, and we'll also be able to talk about opportunities that you have to stay healthy for the rest of your lives. We've been in our office in Tamarac, Fort Lauderdale for the past 37 and a half years. Actually, February 17th we'll be celebrating 38 years in the exact office where we are right now. There used to be cows in the backyard, but now the neighborhood has grown up around us, and we work with probably 50, 60 dentists in the community and their physicians to provide the best possible care for their patients. We also work with their physicians to make sure that whatever we're going to do for their patients is going to benefit their health and enable them to have a more comfortable lifestyle. We treat patients of all ages. Our youngest patient up to date has been 3 days old. And we were referred that patient by a lactation consultant because we treat babies who are tongue-tied and can't nurse properly. Those infants we treat with a laser, and their moms come out about 10 minutes later and say, he can nurse now. It's a wonderful life-changing event for both the mom and the children. We also treat adults up to, I guess we treat the great-grandparents of the babies. And I can tell you that we're able to reconstruct their mouths so that they can eat properly, they have proper nutrition, so that they can have proper health and be able to have nourishment and be able to smile with confidence. In South Florida, a lot of our seniors, unfortunately, are single, and going out to eat is a big part of their social life. If they can't eat properly, they're very uncomfortable, they're embarrassed. They don't want their date to know that they don't have teeth. So we do everything that we can to make them comfortable socially, and when they go out to eat, they don't have to take their teeth out to go in and clean them out after the meals. They can have a complete social life. They can go dancing and whatever they want after their meals. So that's a big part of what we do. Traditionally, as a periodontist, I treated gum and bone infections of the mouth. But today, we do a lot of implant procedures to replace one, some, or all of our patients' teeth, whether these teeth have been missing for decades or just have to be removed at the time of our treatment. We treat children of all ages, as I said, and adults. We do cosmetic procedures. We treat patients who have gum recession. We treat patients who have the long teeth and the recession. We treat patients who have gummy smiles or short teeth. We treat patients who have bad breath problems. We do a lot of work with our laser today. With a laser, we can treat periodontal disease, periodontal pockets, with no stitches. We can treat them without anesthesia and with no pain at all. We use growth factors so that our patients heal better, quicker, and faster. And we use sedation. Patients are anxious when they go to the dentist. And you know, even the biggest guys, probably the biggest guys are the most anxious. In my previous life, I treated people who were football players for the Miami Dolphins. And these big guys don't like not being in control. So they're extremely anxious at the dentist. And when I trained in Philadelphia, we had patients who were on the Philadelphia Police Department. So dental anxiety is important, and I can tell you that we make even the most anxious patients comfortable so they only have a pleasant memory of their visit to the dentist. We'll be right back in a couple of minutes. I'm Dr. Kenneth R. Levine with Health Talk. I look forward to seeing you soon. Thank you.
Keep on smiling, 'cause when you're smiling, the whole world smiles with you. Ba 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 da ba, ba 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 da ba.
Hi, I'm Dr. Kenneth Levine, and welcome back to Health Talk. You know, as a dental specialist, I get to work with fine dentists and prosthodontists throughout the community, and many of these are going to be our guests on our show. Today, we have a unique opportunity to meet not only two of the greatest dentists that I work with, but also a husband and wife team. They're going to talk with you a little bit about their practice and their life together as dentists. I'd like to introduce Dr. Maria Scabi and Dr. Paul Garcia. How are you?
Thank you. We're very fine. Very good, Kenny. Thank you.
You know, when I started thinking about this show, I thought of you two immediately because you have such a unique situation whereby you work together almost every day. You go home and you have two kids that you share and a life that you share. And can you fill us in a little bit? We're going to talk about dentistry. Let's talk about what it's like to be married to a dentist.
Well, first of all, we met in dental school back in 1990 in New York. We went to NYU, New York University, where we met. I was 1 year ahead of Maria, and you know, right away I kind of like this woman here, and so I started offering my tests and my previous work and all the help that I can offer her, so she can make her first year go by easier. So
you tried to sweeten the deal.
Yes. I offer her all the help that I can,
Right.
in dental school. So we finished dental school in '94. We came back here to Miami, and now we practice in Sunrise. It's funny, we've been working for almost 13 years together, but in the office we are in a pretty busy office, and we really don't see each other that much in the office. We're so busy doing, she's working with her patients, I'm working with my patients, and I mean, it's great. We complement each other. Sometimes, I will consult her on, certain procedures. She will help me. I do the same for her. And but when we go home, we really don't bring the dentistry part of our day home. I mean, we have two kids, we have to raise them, and we spend a lot of time with them. But it's great to know that you have somebody that you can actually consult anytime you have any issues with in your professional life also.
When my son was young, he was 8 years old, I asked him if he wanted to go to the office with me. He says, absolutely not. I said, why? He says, I've seen what you do, Dad. That's gross. You put your fingers in people's mouths all day long. Do your kids ever talk about dentistry?
Never. I don't think either one of them have.
Well,
interest.
no, actually, our daughter, I mean, we have, of course, they both have been in our office, but if I have to pick one that say, okay, this is the one that will follow our profession, it'll probably be my daughter. She's the one that will go to the office and, kind of like take a little peek, to the patients.
She's a little curious, but it's not
our,
that she.
Our son is more into the, technology things.
Well, you brought up a good point, because when I was in dental school, long before you, we had 104 students in my class, and there were only 3 women, one of whom had been a foreign-trained dentist who was an instructor of mine. I know that's not the way it is today. Certainly more than 50% of the dental students are women. And in some countries, I was talking with a dentist from Panama, she said 90% of the dentists when she went to school were women.
Wow.
And I don't know what your experience was. How about when you two were
Well,
in school?
when I graduated from NYU, it was the first class that graduated 50-50.
Really?
And that was in 95. The first class that graduated 50% women. So it's been the largest.
think-
And after that, I think.
I mean, I think it's really a great profession for women. You basically can make your own schedule. You have the artistic abilities. You know, it's since you can get your own schedule. It's easy to raise your kids. You know, she's the one who will pick them up after school, go home, do the homework, take them to dancing lesson. I mean, my son, I go to his baseball, you know, practices and all that. But I think dentistry right now for women is a great profession, and I do have a lot of patients, young girls, and they come and they ask, and I encourage any women who's interested in dentistry. I mean, go for it. It's a really rewarding and a beautiful profession for a woman.
You know, there was just a study, they listed the 100 best professions in the United States. Number 1 was dentistry. So we're going to come back in a moment. We're going to talk about more aspects of dentistry with Dr. Paul Garcia and Dr. Maria Scabi. Thank you.